aware that traditionally we normally get together on the first Saturday in November for our annual Christmas fair and coffee morning. It's become an annual fixture in our calendar, and it's always a highlight. It's always something that we really look forward to, because it's an opportunity to catch up with friends and with family and with those of you who support us throughout the year, and also to meet new people as well. It's a morning where we drink lots of tea, and I've got my tea with me this morning, an opportunity where we get to have lots of tasty treats, and also we're able to do a bit of shopping at the TLM Christmas shop. And obviously, for obvious reasons this year, we haven't been able to do that, and we're disappointed. We miss you. We miss meeting people face to face, and I'm sure you do as well. And so this morning, really, this is an opportunity to see you, but also really just to try and connect with you and connect with the work that's going on across the world to create that sense of community. It's not everything that we would want it to be, but it is something, and I'm sure you will agree with me that at times like this and the circumstances that we're all facing, that something is actually important in these days. And so we are delighted just to have this opportunity to connect with you. And I do hope that this morning you find it informative, that you find it encouraging. And we would encourage you at the end, we'll be finishing in around the 11:30, but we're going to keep the room open here for 15-20 minutes. And we would encourage you to hang around and to have a chat with folk. Maybe there's a face you recognize on the screen, and we would encourage you to hang around and to have a chat with folk. One of the great things that online events and online meetings allow us to do is to actually connect with our global colleagues in a way that we haven't been able to do before. So Shivakar was saying at the start there, just as we were beginning to kick off, that he had actually the opportunity to attend in person our Christmas fair and coffee morning many years ago when he was here in Northern Ireland. And at times we have had the opportunity to host some of our international partners. But as you can imagine, that requires a lot of effort behind the scenes and a lot of cost as well in bringing somebody over here. It's always a wonderful treat in order to do it, and there's always huge benefits in it. But it's lovely this morning that we actually are able to have two of our global colleagues with us on this Zoom meeting. So I'm delighted that we have Shivakar Kandal from Nepal and also Teve Anya from Nigeria. And this morning, I'm just going to take a little bit of time just to ask them a few questions just about the work of the Leprosy Mission in Nigeria and Nepal, and also then to specifically talk to them about the coronavirus pandemic and the impact that that's having in their countries, but also the impact that it's having for people affected by leprosy, and how your prayers and your support can make a difference at this time. So Shivakar, I'm going to kick off with you. If you would just introduce yourself, please. Tell us who you are, what you do in Nepal for the Leprosy Mission, and even tell us what time is it in Nepal, and even what the weather's like. We're always very concerned about the weather here in Northern Ireland, so you can
right.
even share that with us.
We are about to enter into winter season. It's getting colder day by day.
Now, by cold, what do you mean?
Sunshine. It's getting colder, yeah. But it's still sunshine out there. It's around 4:30 in the afternoon in Nepal. So I would like to thank you all for this wonderful opportunity. This is my real joy and privilege to join this very wonderful event. And more than that, I'm so pleased to meet our friends and brothers and sisters in Northern Ireland. And so I am Shivakar Kandal. I am the country director for TLM Nepal. I joined the Leprosy Mission in 1991. 1991 as a business manager. Then I did my hospital administration, specialized training on hospital administration from CMC Vellore. Then I did 3 months theological course from Belfast Bible College, and in 2011, so for which TLM Northern Ireland has sponsored me. TLM Northern Ireland has sponsored me to do that course. So I have completed that 3 months theological training, theology course. And then, therefore, I'm very, very grateful for TLM Northern Ireland. And I always consider Belfast and Northern Ireland as a second home. You know, it's like my second home. I'm so much attached, and I have a many, many fond memories of my time I spent there together with the people there, and so therefore, Northern Ireland is something that when I pray for the nations, so on the priority first, I will be always praying for the Northern Ireland because I am very much attached with this country and the people there, food, your cultures, various things there. So thank you so much, Joanne. And I served Anandavan Hospital as a hospital superintendent from 2005 to 2010 as an in charge of the hospital. Then I was made in charge of TLM Nepal until 2013. Then I was appointed as a country director of Nepal in 2013. And since then, I'm enjoying my role as a country director. And this responsibility was entrusted and trusted by the Lord. And I really enjoy working together with the fellow brothers and sisters around the world. And I'm very actively involved in Nepal to meet our goals: zero transmission, zero disability, and zero discrimination. So I'm with you together, and I would like to take this opportunity again to thank Joanne, my sister Joanne, and the team, and all of you, that you have enabled us to serve the people even in this midst of this crisis due to this COVID pandemic. So you have enabled us. You helped us so much that we continued our job that was assigned by the Lord, and we work on our behalf, on your behalf in Nepal. We work together, but what I'm trying to say is that we work on your behalf in Nepal. So therefore, we are one in Christ. Therefore, we are one family in the Leprosy Mission. So we serve the same master and we belong to the same God. Therefore, we are one in spirit. So therefore, we love each other and we uphold each other. So this is what I'm telling from my heart.
Thank you, Shabaka. We can get a real sense of that, actually. And I suppose as we think about this morning's event, whilst we might all be in different roles in different places around the world, we are all part of one family, and it's lovely actually to have this opportunity to connect in this way. Teve, can I let you take the floor now as such, and could you introduce yourself and tell us a little bit about your role in Nigeria, and even tell us what time it is and what the weather's like there.
Yes, thank you, Joanna. I'm Teve Anyo. I'm head of funds development, and by the way, it's 11:44 here in Abuja, and the weather is about 18 degrees centigrade. So it's a time of the year when it's a bit cooler because we are experiencing the Harmattan season, which is similar to your winter. Otherwise, on a usual hot day, it gets up to 40 degrees where I'm currently living. And so it's now 18 degrees. And so it's a good weather for us. I have been involved with the Leprosy Mission since 2008. I started off as a project development officer. And now I head the funds development team, which is responsible for project planning and resource mobilization to support the work of the Leprosy Mission in Nigeria. The Leprosy Mission works in at least 11 states in country, and your wonderful support from Northern Ireland supports at least 3 of our projects in 3 locations in 3 states, as well as the country team. So we're thankful for that. And our work focuses mainly on 3 zeros, which is quite an integrated approach to the Leprosy Mission work. Zero transmission of leprosy and other neglected diseases, zero disabilities, and zero discrimination. So these are the key core priorities for the Leprosy Mission in Nigeria. And I'm really looking forward to interacting more with you and telling you more about the work in Nigeria. Thanks.
Thank you, Teve. It's so lovely to have you here with us today. Thank you for joining. We were a bit concerned about the IT connection. Rebecca and I yesterday were saying, you know, hope this IT connection works, especially for Nigeria and Nepal,
Yes.
because if they don't turn up, Rebecca and I would have to do a party piece, you know. So I'm glad that you have been able to connect with us this morning, because it's even things like that that we take for granted here in Northern Ireland. But I know for both you and Shavaka that actually those things can be very unreliable at times, and obviously then can impact the work whenever even things like technology aren't working. Tevi, if we stay with you, obviously coronavirus pandemic, you know, it's hitting every country in the world. Here in Northern Ireland, we're facing now the second wave of COVID-19. Cases are rising, numbers who are being hospitalized are rising again, and sadly there's more deaths. And I know that it's impacting you in Nigeria. Could you just share a little about the situation in Nigeria at the moment, and in particular how this pandemic is impacting the work of the Leprosy Mission, and particularly those people who are affected by leprosy?
We I think as a country, we diagnosed the first case, I think around the 30th of March, and the country went into a lockdown at the end of March, and we were forced to work from home. We had to learn new ways of working and implementing our programs, working through community groups, practicing the physical distancing and observing the NCDC control protocol. We are back now. The country has reopened. Nigeria as a country has so far recorded over 60,000 new cases. A lot of them have recovered, and we have just about 1,000 deaths. So it's not very, it's not as bad as it is in other places. But then you would also agree with me that the testing capability is not as strong and not as reliable as would be in Europe. So yes, there may be lots of cases out there that are yet to be diagnosed. But I would say that the economic harm the economic impact has been the greatest challenge, especially for leprosy affected people that we serve, as many of them dependent on daily income, artisans who have to go out every day to earn an income, to get basic groceries and house supplies. And so all of that was impacted during the months of lockdown and the restrictions of movement. So it sort of pushed leprosy affected persons more into poverty. And the government mobilized the private sector to raise supports of household provision and food items. But again, we saw people with leprosy, people with disabilities, less able to get access those support. And that's one of the areas we have also advocated, and together with our partners in Northern Ireland and in other parts of Europe, we have also, as a Leprosy Mission, been able to support families with basic food items during the period of lockdown. And yeah, we are continuing to raise awareness on how to prevent the disease within leprosy communities, and to also practice safe hygiene as a response to prevention of COVID-19. Yeah, so as it is now, there appears to be a bit of apprehension, because if you had followed the news during the last 3 weeks, there was a protest among young people against police brutality, and the NCDC guidelines were not followed during the protest. Lots of people had no face masks, and there were lots of people crammed together in different locations. So there's a bit of apprehension about the second wave of COVID in Nigeria, but for now, we haven't seen that significant hike in cases yet. So we just pray that that will not be, although it is predicted, it shouldn't be something that will become a reality. We're hopeful and praying for that.
Thanks for sharing that, Teve. I've heard at different points, you know, for different countries around the world. And I suppose, you know, in our own country, we're very conscious of the economic impact of all of this as well. But, you know, I've heard different people say to me, you know, that actually something similar to what you're saying, that actually the big impact for those affected by leprosy has been that it's driving them further into poverty, and actually that people are dying not of COVID-19, but they're dying of starvation actually. And
Exactly.
the need is actually for food, for basic supplies, for access to water, and also things again that we take for granted here, that kind of health awareness, you know, around the disease. I know that in Nigeria, you've been doing a lot in the front line with regard to trying to increase awareness around how people just practice good hygiene and are aware of how they can curb the transmission as well.